Hi, hello everybody. This is just a summary of the course for children in February 2021 for children recovering from traumas. So, point one is that when we're dealing with children with traumas, we need to make sure that they can recognize physical symptoms and when they're not feeling okay. This could be stress symptoms, bad throat, bad head, bad skin, breathlessness, headaches, lightheadedness, things like that. Once they recognize those symptoms, we can tell them about their safety, that means that you're feeling unsafe. So we say the children is feeling unsafe because they've got physical symptoms and they must relate that to physical symptoms. Two, we can ask basic questions to actively assess the child. We can say, is your heart beating faster? Are you feeling nervous? Is there no feeling? Because we're just checking and they can give us a yes or no answer. If the answer is yes, you can try and get the child to relax by breathing and telling them that there are boundaries, that you can get help if he needs it, and there is somebody to talk to, and they can openly and safely in a safe environment talk to you about how they feel. The best thing is not to panic yourself. We can react to something and accept it but not get angry, and explain that they are having a panic and what to do. Tell them to trust Allah and get them to talk in details of what has happened, when it happened, what it reminds them of. Always make sure that they have a strong sense of belonging with you. Teach them always to be open and to say things for you of how they feel. Three, teaching boundaries. That means teaching boundaries when it's comfortable not to kiss on the mouth or to touch someone or to have bad manners, or boundaries of personal space around them. Teach them what is right or wrong and they can say that you're too close or you're not too close. If they're not comfortable with an adult, then that's fine. You can also teach them what are good and bad places in the house, or public places and private places. Some rooms are private, some rooms are public. You can teach them public and private clothes, public and private body functions, public and private body parts, and public and private people. Number five, always tell the child that they have permission, that they can interact with you, that they can be vulnerable, and they can talk to you about anything they want, and they can reach out to you and a bubble of people that they trust, and they can be vulnerable to them. There is no need to hide anything. There's not going to be a major catastrophe, and you will sort it all out for them. The main key issue is about anxiety that children feel, that they always feel like they're on a roller coaster. Sometimes it feels like it's a scary feeling, other times it's exciting, other times it's risk taking. Some people may want to take a risk, they may like it. They may need to start and stop issues together because they're part of a group, and that makes it exciting. It may be fun or not fun, but you need to teach them that these are stress conditions and they can differentiate between what is their body, what is fun, what is not fun, what is an early warning sign, what is their choice, what is their control, their time limit, what is a purpose, or what is a selfish act, i.e., when to stop, feel, think, and act. Six, always teach the child to share ideas and always to be objective of what they are seeing and doing. When it comes to sensitive topics, make sure they know it's not their fault. Be mindful and find ways of discussing things. Make sure that you have a response waiting and not a reaction. Always make sure that they are physically well and they understand their safety. This is how my safety feels. So always give them safe boundaries so they understand what safety is. This is where you don't need to go. This is what you don't do. This is what you do. But also there are boundaries and I can help you with those boundaries in the long run. Always use simple protective factors and make sure the child understands the boundaries themselves. 7, which is the most important thing, is talk to them in a manner where they know how to talk assertively about negative behaviors. They know how to reassure and always tell them to always tell mommy what's going on. Simple problem solving basics. And find reassuring people to talk to in the community. Number 8, always make sure that there's adults to speak to. Pay attention to the child's emotion and sense of safety. Talk about the Islamic principles of boundaries. And talk about the concept of issues and the concept of bad topics. Make sure the child understands its gut and its intuition. When handling angry people, make sure you understand that it's their ego. You can tell someone if they're offending you, that I feel offended, and act in the way to make sure what you say is what you do and that you feel pain.